So good afternoon, everybody. My name is Hallie Leinhardt. I'm the Outreach Specialist for the Center for Financial Security at the University of Wisconsin-Madison. Thank you very much for joining us for today's webinar, Health Insurance Literacy and Consumer Engagement. We're very fortunate to have the following presenters lined up to speak on today's webinar. We have Justin Sidner. He's the Associate Professor in the Department of Risk and Insurance at the Wisconsin School of Business, and he's also the Associate Faculty Director as well as Acting Interim Director of the Center for Financial Security. Allison Espeseth is the Development and Operations Manager at Covering Wisconsin. Just a reminder before we get started with the presentation, to submit questions to be answered in the question and answer portion that will take place in approximately the last 10 minutes of the webinar. Please submit your question in the Q&A box located on the left side of the screen, and feel free to do that throughout the presentations. Also, just as a reminder, we are recording today's webinar. It will be available within 3 days on the CFS website for your viewing after the live event. And with that, I will turn it over to Justin.
Great. Thank you, everybody, for joining us today on the webinar. So I'm going to kick things off with a bit of a description of some current academic research about health insurance, and in particular about some of the challenges of the complexity of health insurance. And then I'll pass it on to Allison to talk more about the community engagement side of things and sort of the practitioner side of things. My background is in behavioral economics, and one of the topics I've been particularly interested in the last year or so is how people are dealing with the complexity of health insurance as we see this push in the U.S. towards more what I would call consumerism in health insurance. And, you know, when I talk about consumerism in health insurance, I think this basic perspective, this idea that people, rather than just being patients, are going to be consumers of healthcare and consumers of health insurance has really taken off in the last 10 years. And it's been a big part of shaping some of the reforms we've seen in the healthcare space. In particular, if we think about insurance plans, the expansion of insurance coverage through the Affordable Care Act has largely been centered around the idea of people shopping for insurance plans on insurance exchanges. We also are increasingly seeing some of this in employer-sponsored plans as well, where employers are now offering multiple plan options, sometimes, you know, many plan options to their employees, all with this idea that people will be able to select the plans that fit their personal needs and interests best. There's also sort of simultaneously been a number of pushes towards trying to empower people to be consumers on the healthcare access end. For instance, there's been the development of tools that allow people to potentially compare costs across doctors or medical facilities, access ratings for those things. And all of this is part of sort of a movement that assumes that people can navigate these things well, and that by doing so, they'll be able to get good quality care, but also hold down costs. And the challenge that I think it's worth all of us knowing, and I think many of you, given the background of where you're coming from, will have a sort of natural instinct around, is that the more we study this move towards insurance consumerism, the more the research seems to be suggesting that it has some really problematic features and that the complexity of insurance is really troubling for people. And so what I want to do is I'm going to start by talking a bit on this end of insurance choice, which is where I've done most of my research. And then at the end of my brief comments here, I'll talk a little bit about a recent study by another set of academics who have looked more at this question of what happens when we supposedly empower people to be consumers on the doctor and medical facility side. So on the health insurance choice side, I like to sort of break down the issues that we see people facing in these markets in sort of two ways. So, and I break this down into what I call choice overload and insurance complexity. Choice overload is a long-standing idea that's come out a lot, actually, of studies in marketing, sort of the way people behave, for instance, in grocery stores. And the basic idea of choice overload research is that, you know, there's this paradox of giving people lots of choices, in that in some sense you think many options will give you a chance to sort into the one you want best. But people also find that level of choice often very overwhelming. and many times give up in the face of overwhelming choice. And rather than searching for the product that might best fit them, working to understand it, they fall back on some other choice pattern. So they might just select the one at the top of the list or be easily influenced by someone who recommends for them, potentially if there's a default choice. And this research, and there's been a lot of research of this type, is especially relevant, I think, for the Affordable Care Act exchanges, where often people have to choose many, many plans. And we also see it in Medicare Part D plans. And here you see people having to choose across different providers as well as a number of financial characteristics. There's another piece, though, that I think is especially important and maybe in some sense less appreciated at times in this, and it's that there is also just a fundamental complexity about insurance. You know, health insurance contracts are these contracts that pay for part, but generally not all of your medical care, and they require an upfront payment in premium, and then they cover most but not all of your care, and understanding how that works is exceedingly complicated for people. And in particular, what I want to highlight today is that it's not about the fact that health insurance plans are super fancy. They are. And it's not about the fact that they have so many different features, deductibles, co-pays, co-insurance. They do. All of those things are problems. But it's even just at its most basic level. Any of these contracts where we have a feature where things aren't fully paid for present a lot of challenges for a lot of people. We just don't have that sort of natural insurance literacy. And so I want to talk a little bit about my own research that touches on that issue to kind of highlight the sort of things we're finding. And so, sorry, let me click down here. So the first thing, everybody, I want you to take a look at this slide here. And on this slide, I have a hypothetical choice between 4 plans. And I want you to imagine, for your cases probably, that these are offered to you by your employer, and that all of the plans offer the same access to doctors and hospitals, the same network. So they all have the same quality of what you can access. But where they differ is on their annual deductible, the amount you have to pay out of pocket before the insurance starts covering costs, and the annual premium. Let's take a second. Think about which one of these plans would you choose given just this information. Okay, uncomfortable silence aside. If you're like most people and you're looking at this, you know, there are a couple of different things you might be doing. And our research on sort of average people is that, you know, some people are going to look at this and think mostly about the deductible. And so they might say, for instance, to themselves, well, I think I'm relatively healthy, so maybe I should choose plan A or B. Other people might look at this list and say, you know I need a lot of health care. There are a number of specialists I have to go to, so I probably need more coverage. I'm going to go with something like C or D. There's another set of people who are going to be very focused on the premium. They're going to think about insurance and recognize that it's sort of complex and they're not quite sure what the value is, and so they want to minimize how much they pay. So they might be choosing option A and trying to save on premium that way. But what relatively few people do is the way economists would think about this. And this is important for thinking about how did we get to a world where people are offered these types of contracts, where they're not quite sure how to compare contracts with different deductibles versus their premium. So for economists, what we think is that people would look at this, so and by I mean economists think, our kind of classical models is that people would look at this and they would think about the total amount of money they would end up spending for the year with these different plans based on their healthcare needs. Now, if you did that and you were capable of really understanding how to compare across the deductibles, what you would actually see is that Plan A dominates all the other options on this list. And what I mean by that is that with Plan A, you would have lower total spending for the year once you combine premium and any out-of-pocket costs, regardless of how often you go to the doctor. Now, this is under some assumptions about everything being covered after the deductible, but to make that clear, what you can see is Plan A dominates the other options in the sense, take a look at Plan A versus Plan C. Okay. So Plan A versus Plan C, there's a $500 difference in the deductible. That difference means that with Plan C, you might save $500 in out-of-pocket costs. If you need to go to a doctor a lot, you'll hit the deductible at $500 instead of $1,000. So you might save $500 in out-of-pocket. But now look over at that last column at the premium. you're paying an extra $602 for the year in premium. That's for sure. And so you pay an extra $602 to avoid the possibility of $500 in out-of-pocket costs. So if you make those sort of choices, and that's true for B, C, and D, you would definitely spend more money for the year relative to option A. Okay? And now that's not at all obvious to most people, and we know that because this menu actually comes from options that were really presented to employees of a large Fortune 500 company, where they have a very wide mix of employee backgrounds in terms of education and salary. And what we found was that employees offered these types of options where some of the options are just transparently better in terms of their finances for people. People cannot spot that, and they can't notice it, even if we kind of boil it down to something this simple. And so to show you that, in our study, we studied a large sample, about 23,000 different employees. I'm sorry that the x-axis here is cut off a little bit, but I'll describe it to you. On the x-axis, what we have are the salary ranges of these employees. So all the way on the left-hand end, we had a number of employees at this company who were making essentially minimum wage. Moving up just a little bit along that x-axis, we had some, sort of supervisors in a kind of retail setting. But all the way on the right-hand side, we had people making over $100,000 a year, professionals with a lot of training. And on the y-axis, what you see are the fraction who ended up selecting a health plan that was dominated in this way, where there were alternatives available that would save you money for sure for the year. And what we found is that overall, the majority of employees ended up selecting one of what we would think of as these bad plans, and that it was especially high rates of doing so among employees with lower income levels. Okay? They were less likely to sort of spot the value of these plans. And we found that for the year, what would happen is that the average employee making one of these choices could end up saving on the order of $350 for the year for sure if they had selected a different plan. And that's a sizable amount of money. And we found that it was also more likely to happen to older employees and also employees with pre-existing conditions who were more likely to select these plans with a lot of coverage, but that ended up being very, very costly in terms of premium. So as we think about this, one natural question you might have is, how on earth do people end up getting offered such bad plans? And if we think about something like the Affordable Care Act or other settings, shouldn't we expect that competition, for instance, might eliminate bad plans? And that logic makes a lot of sense in most standard markets. So in a lot of standard types of markets, we do think that competition should generally drive bad products from the market. And in particular, in a standard market where people can understand what they're buying, competition helps make sure that they're getting something of high value. Insurance, though, has kind of two problems. The first is because it's so complicated, people don't actually know the value of what they're buying, and so it's hard to spot the good versus the bad plans, and that makes it harder for competition to work. The other important thing, and that you see on this slide here, is that insurance competition also has this problem that the way competition works in insurance is that the costs for your plans tend to end up reflecting the costs of the people who choose those particular plans. And so the problem you get is if there are certain plans that attract a lot of healthy people, like my little guy here in the cartoon running with his dog, say he chooses plan A a lot, but other plans that tend to attract a lot of people with more healthcare needs, so plan B in this example, then the costs of those two plans can come to reflect their different mix of people. So you end up with plans that are being sold to and priced for healthier people, and plans that are sold to and priced for less healthy people. Now, in most of these markets, it's usually regulated away that you can't specifically try to charge the unhealthy different than the healthy. That's why we have regulations barring different pricing for people with different pre-existing conditions. The problem you run into is that otherwise, if you just design plans that happen to attract different groups of people, it can end up leading to these very different costs where the unhealthy people end up paying for plans that capture their unhealthy nature rather than getting to pool together with the broader population of healthier people as was originally intended. And in our study in particular, we noticed that this was especially likely to happen because people who don't understand what they're looking at tend and don't understand the value of the different insurance tend to focus just on single plan features. So for instance, this logic of just saying, well, I think I'm relatively sick, so I must need one of the plans with lower deductibles and more coverage. That sort of thinking without actually comparing premiums is exactly how we can end up with the unhealthy people sorting together in an expensive plan and the healthier people getting to sort together in a less expensive plan. Now, if people really understood what they were doing, we would expect that as the costs of these plans, like Plan B here, that unhealthy people tend to get attracted to, as they start to rise, many of them would realize that there's low value in that plan and would switch and join the healthy people in Plan A. But because there's a lack of understanding, especially for lower income people with poor health conditions, we end up in this situation where exactly those vulnerable populations are more likely to end up paying a lot for insurance. Now, we have some regulations in the Affordable Care Act setting, some very important regulations that help to keep this from happening too much. But one of the things that we should watch for is that in all of these markets, there's a scope for the plans that people think they want to end up not being priced very fairly for them. So one thing we tested in this study of ours is whether there's any positive way to try to help make some sense of this for people. And so what we did in an initial study is we just looked to see what would happen if I tried to help clarify a little bit of the consequences of your total spending. So what we did is we offered a set of options like this, and we did this in an online experiment with participants, not at our corporate setting, where we couldn't do more surveys. The legal department didn't want us surveying the employees too much once we pointed out how bad some of these plans were for them. But we were able to do online surveys, and what we found there is we offered people, again, hypothetical options like I showed you, Plan A, B, C, and D, that differed only on their deductible. And then all we did is we added a couple of columns explaining how much money total you'd pay for the year, premium plus your deductible spendings, if you were either very healthy, meaning you didn't go at all, so that's just repeating the premium, or if you were very unhealthy and you ended up needing a lot of care, which was basically meaning that you would exhaust all your out-of-pocket payments. And even, so we were curious to know if we did that, would people then be able to understand that in this example, for instance, option A was especially attractive. It dominated the others. And what we found, and for some reason this is kind of whited out here, I'm sorry, but you can at least see the heading here. What we found is when we ran that experiment, by showing people a little bit more about what the consequences were, and not relying on them to understand how to think about deductibles and premiums by themselves, that we got the fraction of people choosing that best plan, the $1,000 deductible one that doesn't have these costs, to rise from 52 to 82%. So what we found is basically a lot of people did not want to actually pay more for sure for the year for these lower deductible plans, and that when you clarified that they were going to, many people didn't. But there's one other important thing from this study that I think is really kind of crucial to highlight, is that even after we show people this, and we've done this in a couple of other spots, we still see usually somewhere in the range of 15 to 20%, in this case it's 18%, of people who still select a lower deductible plan, even after we've gone out of our way to explain that it means that they'll pay more total for the year. And as we've delved into this more, what we realize is that a big part of that may be coming from the challenges of budgeting. That there are people out there for whom the regular payments of premium through payroll deductions are so important for them, and given their budgeting challenges, that even though they in theory could be better off by choosing a higher deductible and saving the extra money that they save in premium to cover those deductible costs, that the challenge of actually saving that money is too high. And so people end up preferring to pay more for sure just to make sure it comes out smoothly. And what that suggests to us is really that one of the issues we face as we see this movement towards consumerism in health insurance that's unlikely to stop anytime soon is that a big issue we face is that we need to help people take advantage of various techniques for budgeting for the out-of-pocket expenses that they're increasingly being forced to pay. So last kind of research takeaways here, and then I'll turn it away to Allison. So the first I would say is that we need to find good ways of making consequences of options much more transparent for people. In some of my current work, we're developing an approach where we can use graphs so that no matter how complex the insurance options are, if they show deductibles and copays and coinsurance, that we could show people the range of spending they might face with these different insurance contracts in a simple visual way where they don't have to understand deductibles, copay, coinsurance, and all of these complicated features. So that's a work in progress, but I think could be an important direction to go. It's also important to realize that there is this smaller but very important fraction of people for whom, as we delve into this and survey them more, they do appear willing to pay high costs right now to avoid out-of-pocket payments, even if those costs are so high that they mean they'll pay more for the year. And that really highlights this importance of finding good budgeting approaches. And health insurance increasingly is supposed to be designed, for instance, with high deductible plans, to give people access to savings accounts for their medical expenses and so on. But those sorts of things are not yet taken up fully, and I don't think people understand them entirely, and I'll talk about that in 1 second. And it also highlights the importance of helping people as we, for instance, navigate the Affordable Care Act exchanges to understand the value and the importance of the cost-sharing reductions. So many people are eligible for a reduction in the amount of deductible they have to pay, the amount they have to pay out of pocket. And it seems like those features are actually going to be very important for a lot of people. So helping them understand that is key. And so the last thing I'll talk about, I mentioned at the beginning that I wanted to talk a little bit about another study that had been looking at what happens when you try to turn people into healthcare consumers for their access to doctors and healthcare itself. And so this is a study not by me, but from some authors at UC Berkeley and Harvard University, where they studied what happened at an employer, a large employer, with a very tech-savvy workforce that transitioned everybody from really full coverage, they had excellent coverage with no out-of-pocket costs, to a plan with a high-deductible health plan. So all of these people now had, for instance, a $3,000 per year deductible, but the company tried to keep things even for them and gave them money into a health savings account, $3,000 worth, so that they, in theory, could pay for all of these costs. And the company also gave them access to very nice online tools, well-designed tools that would let them shop across doctors and providers for care to try to get the lowest cost. And what they found when they studied what happened at this company that did this is that move, even though these people would actually even have the money available because the company gave them to them, this move towards having to pay out of pocket for healthcare costs, these high deductibles, had a profound and detrimental impact on people's access to healthcare. What they found is that the vast majority of the employees, including ones who had chronic conditions that needed regular treatment, pulled back on healthcare. They also pulled back even on care that was fully covered, like routine visits to their doctor for primary care. People just fundamentally didn't understand how to navigate their high deductible plans and what they really meant for them. And so in the face of that, it looks like they simply just decided not to go to a doctor unless they really had to. And that can have a lot of really bad side effects. And importantly, nobody used these shopping tools to price compare. And this is among very high-tech workers. So it really makes us think that it's unlikely to happen in other populations. And so kind of the upshot of this story, this one is interesting because it's one of the economists on this study was a big proponent of this move towards healthcare consumerism and giving people more stake in their healthcare with the thought that it would save money overall over time. And he's now changed his mind and has started to realize late in the game, and maybe some of you all could have told him this ahead of time if he had thought to ask, but he's now realizing that this sort of consumerism move causes more problems than it does good. And I think in practical terms, what this study really tells us is that if we're going to have people facing a lot of out-of-pocket costs, there's a huge barrier to overcome of trying to help them understand how to navigate those costs, how to budget for them, how to plan for them, and even how to think about them, to realize that you don't want those out-of-pocket costs to deter you from accessing important and valuable care. And often things are supposed to be set up to try to prevent them from doing that. For instance, you might get your routine visits covered, but people aren't naturally thinking about that. They just know that they might have to pay, and therefore they're afraid. And so that's a burden on the rest of us to try to help people navigate that. All right, so let me turn it now to Allison, who's going to take over and talk about the important work they're doing at Covering Wisconsin.
Thank you so much, Justin, and thank you, Holly. I'm happy to be here, and I think one of the things that I've already taken away from what you've been talking about, Justin, is I really like the approach you showed of the one slide showing cost if you're healthy and cost if you're unhealthy. I really hope to see that in future practical work. So what I'm going to be talking about today is really, based on everything that Justin has been talking about with the challenges of understanding and selecting coverage, that consumers can really just become disengaged from this process, given how overwhelming it can be. I'm going to talk about what are some of the existing resources that consumers can use that can assist them in this process. So I'm Allison Esposeth. I'm with Covering Wisconsin. I'm the Development and Operations Manager. And just a bit about Covering Wisconsin. We are based in Wisconsin. We were established in 2003. We've initially focused much of our work on just assisting with education and outreach to Medicaid and the State Children's Health Insurance Program. We have since expanded our work to really, with the Affordable Care Act, to also educating consumers, professionals, really anybody around coverage that is available. So again, both through Medicaid as well as marketplace coverage. We have offices at the University of Wisconsin in Madison and in Milwaukee, and we do still tend to focus on those who are lower income and other vulnerable populations. We focus on those, while everyone can be challenged by choosing and selecting and using health insurance, we really focus our attention on those who are probably new to health insurance, may not even be aware that these options exist for them. One thing I did want to mention is we also, since 2014, have become a navigator entity, and I'll talk a little bit more about that in a few slides. So my goal for today is to give you, just as I mentioned, my own group's perspective on what are some of the ways that, what are some of the resources that can assist consumers. So some of the in-person consumer enrollment assistance options, describe a little bit of Covering Wisconsin's experience being a navigator entity, and then look at some other tools that you or a consumer can use on their own. So broadly, before I even talk about the assistance, just to make sure we're all on the same page, when we go out and talk to consumers and professionals about what are their general options, we typically show this slide. Now clearly this is related to Wisconsin when you see the Badger Care Plus, but these are the four main options. Employer coverage is still kind of the main source of coverage for most people. However, there's also Medicare for those who are over 65 or over, as well as having certain conditions. Badger Care Plus, as I mentioned, is Wisconsin's Medicaid and State Children's Health Insurance Program. This typically is available in all states, but it's typically for lower income children and adults. And then there's the marketplace coverage, also known as the Affordable Care Act, Obamacare. Some states have a state plan or state marketplace. Others, like Wisconsin, have a federal marketplace. What I wanted to really highlight here is that for the marketplace, it is an option available for many people, though financial assistance is really only available if you don't have an offer of affordable coverage through your employer and you're between 100 and 400% of the poverty level. And there's only a certain short window for anyone to enroll. It's the open enrollment period. It goes from November 1st through January 31st of each year. However, others, if there's a change in life situation, there are special enrollment periods where others can apply and enroll throughout the rest of the year. And for Medicaid, what I wanted to really highlight was that you can enroll at any time. This is true everywhere. And also that one of the simplifications that came through the Affordable Care Act is this idea of a no wrong door. Once the marketplace structure came on, they wanted to make sure that when people are searching for coverage options, that they weren't further challenged by, well, where do I look? Do I look at the marketplace or do I look at Medicaid? The idea being that all states need to have a single application, single entryway for looking for their options. And if you apply you are either told that yes, these are your options in the marketplace, or you are actually Medicaid eligible. So in a sense, that's one of the first consumer assistance options I wanted to highlight. And I'm going to go past these next slides just to focus on, so yes, health insurance is complex. We all know that. One study that was published in Health Affairs in 2014, it looked at data from the Health Reform Monitoring Survey, and it looked at the self-reported level of confidence in understanding some 9 key health insurance concepts. So this would be premium, deductible, copay, coinsurance, maximum out-of-pocket cost, provider network, covered services, annual limits, and excluded services. And what was interesting about this, and I just wanted to highlight just even simply the terms, Justin was talking about the search that goes on in selecting, but when we're even just talking about understanding the terms, among those who were insured at the time of the survey, only 49% said that they were confident or very confident in understanding these concepts. And not surprisingly, this fell to 24% when you look at the uninsured population. So what I take from this is that, yes, those without much experience with understanding health insurance, they are the most challenged, but really even anyone who does have experience with health insurance, they're challenged, again, even by just the terms. So consumer assistance, in my mind, the most important thing are the in-person consumer assistance options that are available. And this slide gives you an overview of the main types that are available for, and again, I'm going to focus on Marketplace and Medicaid, and these are available to consumers in each state. At the bottom, I mentioned public program enrollment assisters. These are really meant to just assist those with Medicaid, SCHIP, and other more specific, but again, public programs. Agents and brokers are a well-known resource for helping consumers select and enroll in health insurance in the private market. Not all of them will sell plans through the marketplace. If they do, they must be specifically trained and licensed with all the plans sold through the marketplace in their area. They typically work on commission and are allowed to recommend certain plans to consumers. Navigators and certified application counselors are both new with the Affordable Care Act. They are required for each state. They must undergo specific training and licensing. The navigator training typically is a little bit more expensive, and there may be both. So for example, in Wisconsin, our navigators must go through both federal training and licensing as well as state training and licensing. In navigators, as opposed to certified application counselors, they both enroll. Navigators also participate in activities even more broadly, so they do a lot of public education outreach and that kind of thing. Though it is important to note, so as I mentioned with agents and brokers, they typically work on commission. Neither navigators nor certified application counselors can accept payments for their services, nor can they specifically recommend a plan. So let me mention and give you an example from our perspective as covering Wisconsin as a navigator entity. As I mentioned, we started back in 2014. This is our second year, and we will continue for at least another couple years through the continuation of our grant. We currently serve 23 counties with 16 navigators, and we are one of 3 navigator entities that serve Wisconsin communities. And you see on this map here, it actually shows our former name, which was Covering Kids and Families Wisconsin. But these are the 3 navigator entities that serve Wisconsin. You can see that we are in green, another is in purple, and then another is in yellow. And then there are also counties that aren't specifically served by navigators. They may be served by certified application counselors, though, as well as agents and brokers and the public enrollment specialists, though I will note, especially also for certified application counselors, typically these are found at community organizations, and there may be limitations. They may only serve those that are their own clients or patients. One of the things I'll also mention, the stars on this map, For us, we have navigators that we directly employ, and we also have subcontracts, so throughout our region, and so the stars show where the main offices are. So to also give you a sense of what does a navigator do and what does it look like, the kinds of appointments they have. So for example, during open enrollment, which is our most busy time with appointments, again, that goes from November through January. This past open enrollment, we had 1,429 enrollment appointments. We typically serve those who will serve anybody. Really, anybody can use the services of a navigator. The appointments are free, but most often we do tend to serve those who are either lower income or have complex cases, or again, generally just have situations where it's a challenge for them to do this on their own. Navigators hold appointments, especially during that period, every day of the week, sometimes evenings and weekends. I know a lot of our navigators, given particularly the life challenges of those they're assisting, they will do what they can to meet them where they are. They may have transportation challenges, they may have work challenges such that they can't get off work. We typically try to hold appointments otherwise in accessible spaces. So for example, in Madison, we have had an arrangement with our public health office where we have navigators that hold appointments on regular days throughout the week. And this really works out well, one, because a lot of clients know where the public health office is, it's accessible, there's parking, or it's on a bus line. Also, there are clients that come through the public health office for other reasons, and they may be able to refer them directly, and so they can just go within the same office if they have time. The time spent in a single case, most of the time it's about 2 hours, maybe a little bit more for a pretty straightforward case, though it really can go to 12 hours and beyond. It's less common, but if the cases are complicated, and obviously this isn't all in one day, but it's over several days or weeks, just in going back and forth trying to figure out, and this may be because perhaps the consumer is struggling with trying to figure out a plan that meets their needs, and they need to really think about this. There may be difficulty in understanding what kinds of income for their situation needs to be counted, a whole range of various reasons why it could go that long. And lastly, I'll just point out, so as I mentioned before, navigators really are charged with more than just enrollment appointments, especially during the non-open enrollment period, but really any time. There's a lot of really outreach broadly, trying to make sure that people are aware that we exist, making sure, so this is both with consumers, so you may be doing a lot of direct-to-consumer outreach or working with the media to gain attention, but you may also be working with a lot of just connecting with community partners, making sure that they're aware that they can refer their clients and consumers to the Navigator entity, and also collaborating with other types of assisters. If they're, especially again during the open enrollment season, it's so busy, making sure that there are resources. You know, the main thing is we want to be able to have the assistance available for consumers when they need it. But you can see here the variety of things. A lot of the other work that we do is post-enrollment or outside of the actual enrolling for assistance, maybe filing appeals, working with tax issues, and actually helping people, once they have that coverage, how do you use it? So here are some resources for you if you're working with clients who need assistance, who want in-person assistance. These are 3 great resources. This is what we tell others of how do you find someone in your area. So there's the CMS, which stands for Centers for Medicare and Medicaid Services, the Find Local Help. If you go there, you type in the zip code, it'll bring up what are local resources for navigators or certified application counselors. Pretty similar is the Enroll America Get Covered Connector. This one is a little bit more detailed, I believe, but similar. And then there's also 211. And 211 is available in most states. They are really there to help you get a live person when you call, and it's really there to help connect individuals to what are the kind of basic human services available in their community. It's designed by the Federal Communications Commission, and it's really to connect consumers to essential community services like food, health, housing, finances, and so on. And next I'll just talk about some other tools that are available. So I already went over the in-person assistance. These are tools that follow that could be used in combination with in-person assistance, or a consumer or somebody helping a consumer can help them walk through these on their own. So the first one is the Centers for Medicare and Medicaid Services. They have a marketplace plans and prices tool. Now, based on what Justin was talking about, again, this may be something that would be best gone through with the assistance of someone else. But of course, a consumer can go to this tool on their own. You put in your zip code, the number of individuals seeking coverage, the age of each person. You may also put in if there are specific prescriptions you need, if there are a certain doctor or clinic you want to keep, and then it'll bring up, and I just put in just some information here. In our area here, it says 82 plans available. Obviously, you can sort and filter. And what's nice about this is that it does show you, tries to show you the breakdown of the costs that would be associated with that, with the different plans. The Enroll America Plan Explorer is similar, though it actually gives you a little, or it has the opportunity for you to provide a little bit more detailed information as you're entering information about yourself. So it asks about whether you're an American Indian or Alaskan Native, or if you're a current smoker. Both these things could affect the plans and costs. It asks even more in depth about the specific health conditions you may have, and as well as if there are provider types and the kinds of and the number of visits you might anticipate for those provider types in the coming year. But again, it'll bring up the number of plans that are available to you, and it allows you to compare plans that you like and look at them side by side. And then the Enroll America Resource Hub. This is a really extensive list of what are called health insurance literacy type resources. These come from state and national organizations, and I just put a screenshot here. It's broken up into various categories about choosing plans, selecting plans, enrolling in plans, using coverage, all manner of things. What's nice is that it does try to show you if it's available in other languages. Is it meant for consumers themselves to use, or is it really meant for somebody to help guide a consumer? Things beyond that. And what's nice also is that it gives ratings that people who have tried to use these and how valuable they found them. And finally, I wanted to showcase our own resources. So these are Covering Wisconsin's resources. We've been developing them over the past couple of years. This shows you a screenshot of our website and where you can find them. It's so critical ever since we have become navigators, recognizing the whole lifespan, the whole point A to point B of trying to select and use health insurance. And so we've been dedicating a lot of time and energy to developing resources that we think consumers themselves can use. And what I wanted to highlight about these, and I'll show you just a few examples of what they look like, we've really been focusing on these are materials directly that consumers themselves can use, that they aren't going to require that somebody walk them through to help them understand. We've been focusing on those who have overall low literacy, so not even just low health insurance literacy, not even low health literacy, just overall low literacy. We want them to be accessible to those who are challenged by the complexity of health insurance. And obviously anybody can use them, but we really wanted to target this population. We use things like plain language, relevant images that really reflect, so not stock images, but images that really try to convey information on their own, obviously things like white space and large fonts, but two things I wanted to really highlight. One is that many of the resources that are out there, they tend to, when they're describing health insurance and how to use it, tends to be more of a narrative. They tend to present information in concepts as opposed to what do you do with that information. And when you present information in a narrative format, it tends to expect that somebody has a higher level of education, that they can think about it and compare it, or then figure out how they're going to act on it. And so what we do is coming from the perspective that here's somebody who may not have ever had health insurance or really know what to do with it. We are going to give you the steps. We're going to say we're going to start with point 1, point 2, point 3, and go through these steps to help guide you, to get you in the door so that you get some experience and can feel more confident going forward. The other thing I wanted to point out is that we do consumer test all of our materials. We really want to make sure that consumers in this audience who are lower literacy, lower income, not used to health insurance, we ask them what things about the materials as we're developing them are confusing, or what things don't they understand, or pictures don't make sense, or content is still just not quite understandable. So here's one example. This is the Getting Started. This is aimed towards the audience that is looking at the marketplace. It's both action steps in figuring out all your different costs, but it also, through the action steps, then defines what different words mean. So again, trying not to put it as a narrative, as just paragraph form and defining concepts, to really try to make it engaging so that you're walking through a process and at the same time you're learning about it. And this just shows the backside, where at the bottom there's a worksheet. This is for people who are more comfortable with pen and paper, may not be comfortable with using online tools. And then another sheet, I'll just show you, this one is Plan for Your Budget. What you'll notice is that this also incorporates some of the same concepts, but we are approaching it from a slightly different perspective. This is the other thing that we really try to take into consideration, is that consumers are at different points in thinking about health insurance in different ways. They're approaching it, one person's thinking about just their budget, one person's like, I'm at the marketplace, what do I need to do? So we're presenting the information at from different perspectives, including, still continue to define terms as appropriate, but yeah, trying to meet consumers where they are. So broadly, if using these fact sheets or other sheets that you may be assisting your clients or patients or consumers, think about the concepts, the questions, come at it from where their questions are. Try not to put in front of them things that they're not even thinking about. Listen to the questions, think about which sheets really are answering that specific question, and giving them the confidence to handle that such that they can then put that aside and move on to the next new question. So we think about this as teachable moments. Try not to overwhelm. You put a bunch of information in front of somebody, and chances are they're not going to look at any of it. So just very specific, very focused. And I'll leave it there. I neglected to put our website on there if you wanted to take a look. We do have many more fact sheets. Our website is coveringwi.org. You can find them there under the Resources tab. But certainly if you have additional questions, feel free to contact me or Stephanie Sievers, who is our lead on our health insurance literacy work.
Excellent. Thank you so much, Justin and Allison. I really appreciated those presentations. And we do have some questions from our listening and watching audience. I'll start with this one that I'm going to pose to Allison. So the Wisconsin, you outlined this Wisconsin Navigator collaborative, and you showed that excellent map that kind of showed how the navigators are broken up to the different regions of Wisconsin or the different areas of Wisconsin. Do you know, is that a pretty typical model in other states as well? So we can kind of assume that much of what you were talking about with the Navigator model, that that's similar in other states.
Yeah, so the navigators are required in every state, even if you have a federal marketplace or a state-based or what's called a state partnership. I'll talk from the perspective, as I mentioned, Wisconsin is a federal navigator, or excuse me, has a federal marketplace. And so each state is required to have 2 navigator entities, one of which needs to be a community-based organization. And so I haven't delved into this that deeply, but I believe that is the case even with state marketplaces. But again, I know that navigators are required, so I'm guessing that they're going to have at least 2. And obviously in Wisconsin we have more than that. And that's the case that that's the way it's been in the past couple years as well.
Great. Justin, I have a question for you. How useful are National Committee for Quality Assurance and similar data for consumers deciding on insurance plans? Are there third-party organizations that help consumers decide on health insurance plans?
So, great question. In a lot of ways, actually, it may turn out to be a better question for Allison than for me. I'm not aware of very many effective sort of third-party sites. There are cropping up to be a number of the types of brokers that Allison mentioned that are active in the ACA space. Those brokers, I've been in touch with a couple that are starting to do a better job of creating visual platforms and other ways to help people make choices that doesn't require them to understand as much. But those so far have been very limited state-based things. So these will be brokers who are eligible within a particular state to offer plans. So for instance, I'm forgetting the name now. I know there was a neat new one started by a couple of young people out of Harvard that was offering some innovative ways of looking at plans for people choosing in the California exchanges this past open enrollment season. And I expect that they'd probably be increasing. And yeah, so Allison, I don't know if you have other things you would recommend along that line.
Well, I know that, so the ones that I mentioned, those are, again, more national. So I have no doubt that there are others that are being developed to try to improve on that. I know that state-based marketplaces often do have their own kinds of tools. And if you look at I'm thinking, it must be the Enroll America Resource Hub, where I noticed that they have a number of them listed. Again, you'd have to scroll down to find exactly what category it's included under, but yeah, I know that I saw a number of other state-based ones, so that may have been like the California one you just mentioned.
And everyone, I'm sorry, I'm going to actually have to duck out because the fire alarm is going off here in good old Granger Hall on the University of Wisconsin campus, so I'm going to have to head outside, but I'll leave it for Hallie and Allison to finish off the webinar. Thanks, everybody.
Thanks, Justin. Okay, good timing, because my next question is actually for you, Allison. So you had mentioned that the Covering Wisconsin materials are consumer tested. So we have a couple questions that relate to that. Are the so those materials that you showed a few examples, are those all or most of them relevant for a nationwide audience? Part 2, I'll just give these to you and then I can remind you of this question if you need it, Allison, but I'll give it to you all right now. Were they tested with people who perhaps English is not their first language? And are they available in different languages? I'll let you get started with those first few questions.
Yeah, and actually we do get these questions a lot. So these are they were developed with the Wisconsin audience in mind, which of course is what we know the best. However, that said, we have already worked with partners in other states to help to modify them a bit to be more accessible, well, I shouldn't say accessible, but to be more relevant for their audience and their specific structure and the kinds of resources that are available in their area. So there's that. And then when we worked with consumers to test these, we do as best we can to, as I mentioned, really work with consumers, like I said, who are either lower literacy, lower education, lower income, new to health insurance. And we have tried to work with those who, for English is not their first language. We are currently working on developing Spanish language resources for many of our fact sheets. And that's a very interesting process too, because it's not simply translating them. It's still holding to, okay, we want to make sure that they're translated, but also we want to make sure that they're in that plain language, that they are still accessible to our lower literacy audiences. So we're actually still in the process. We're getting them translated. We've had a lot of review of a number of them, but really making sure that we are hitting that same mark with the translated pieces, and as best we can, reviewing them with consumers who are Spanish speaking.
Great. And kind of piggybacking on those few questions, when you were discussing who these materials make sense to provide them to, so the consumers, this question relates more also to who can present these materials to them and who makes sense in that capacity as well. So I think a lot of people who are having to face, or a lot of service providers who are having to face a lot of health insurance questions these days are not necessarily, well, they're definitely not experts in that sphere, but they're also maybe not even very knowledgeable at all. So are these the kind of materials where somebody who is, a service provider, a social worker, a financial counselor, somebody who's not familiar with health insurance, are these the kind of materials that make sense for them to provide to their consumers, knowing that they might not be able to give the best information themselves?
Well, knowing that, what we really try to do, and really what Covering Wisconsin has long done, is we both try to provide education and resources to the consumers themselves, but also do a more train-the-trainer approach. There are so many professionals and those out there who work with consumers who do their best to provide them with the resources and referrals to agencies that can more specifically help them. We want them to feel confident in what the information they're even providing. So we do offer trainings to organizations to understand, so we go over what the resources are. We walk through them as though they were their consumers, because we know they need to learn exactly what is the information and how should I understand it so that I can then share it with a consumer.
Excellent. I think I'm going to just slip in one more question, one final question. This is an interesting one, and I don't think we had covered it much, so if you have an answer, great. But how much do consumers need to actually investigate the quality of care in addition to cost of health insurance?
Oh, yeah, that's a good question. It is important, and it's something actually we are also working on as well. Our mission is not just coverage for its own sake. Obviously, it's coverage so that they can then get the care that is quality and appropriate for their specific circumstances. We are working on resources and education around understanding quality. Quality can be defined in so many different ways, and typically consumers, when they think of quality, they think of how nice was my doctor to me, did they listen to me, which are really important, absolutely. But we also think of quality more broadly as, well, was the appropriate care given? And so we're starting to connect those dots. There are resources out there already, like the Choosing Wisely campaign, does look quite a bit at appropriate care that's evidence-based. But we are developing, like I said, resources and education around looking to what tools are already out there to help consumers. I know in Wisconsin we have one with the Wisconsin Health Information Organization. They've been developing a database about how to look for providers and what are the ratings of the providers based on the appropriateness of their care. So that is something that we're starting to show both consumers and the professionals who work with them.
Great, thank you so much for answering. And with that, I think we'll draw to a close. So thank you everybody who's on the line and who registered and took part today for participating. And thank you so much to, I know Justin is not he's not here anymore, but thank you so much to Justin and to Allison for your presentations. They were excellent and very informational. Just as a reminder, this webinar will be archived, and that will be on our website, cfs.wisc.edu, within 3 days, posted with the PowerPoint, and Allison can provide us with a link to her website as well, so you can find that, the Covering Wisconsin website link with all of these materials as well. And then I also wanted to mention that we do have a upcoming webinar that will be in May. It's going to be a CFS and Asset Funders Network collaborative webinar. We're going to present findings from the first ever 2015 financial coaching census, and I will be distributing a registration link shortly. So within the next week, that will be arriving in inboxes. So keep an eye out for that. Again, I'd like to thank everybody for participating today, and thank you to our presenters, Allison and Justin. Have a nice day.